Hello, good morning, bonjour, buenos dias. Welcome to classroom. Today we'll be talking about a fun topic. We are still in the cardiovascular system, the blood vessel. So before we resume today's class, I would like us to have some imagination check. Have you ever wondered why our body doesn't swell up like a balloon every second? It's all about the pulling and push out happening in our capillaries. So today, we've been talking a lot about the blood vessel, the capillaries, or just what they do. But what we didn't talk about that we are going to be talking about today is how the fluid goes out and in of the capillaries. There are two main forces that decide whether fluid moves out or in of the capillaries, and that's what we'll be looking into today. And the first the first force that decides whether fluid goes in and out of the capillary is the capillary hydrostatic pressure, and I call it the push out. I call it the push out because it helps me to remember what it does. The capillary hydrostatic pressure, I call it the push out. This is the blood pressure inside the capillaries, like the blood pressure inside the capillaries, and it pushes out the water, the dissolved substances out into the tissues. So when you hear the capillary hydrostatic pressure, just know it's the push out. It's the pressure, the blood pressure inside the capillary that causes fluid to be moved out into the tissue. And it is stronger at the arterial side of the capillaries, because that is where the filtration happens, the fluid goes out into the tissue. And imagine this scenario as you're holding a hose, a spraying hose, a garden hose, and the way water is flowing out of the garden hose, that is because of the hydrostatic pressure, the pressure that is inside the hose that is causing the water to splash out from the garden hose. So that's the same way this capillary hydrostatic pressure does. So the second force is the capillary osmotic pressure. I call it the pulling. So this pressure is created mostly by the proteins and the plasma proteins, like the albumin. So this plasma protein, they are too large to cross across to move across the capillary wall, so they just stay there and act like a sponge. And what do? They reabsorb those water that is in the tissue. They reabsorb it. So in this capillary osmotic pressure is mostly at the venous end of the capillary wall. Yeah, they are mostly at the venous end of the capillary wall, and the osmotic pressure is higher, and that is why there's a reabsorption of fluid back, because the plasma protein is so large to cross across the capillary wall, so they reabsorb the water. But we all know that it is not every fluid that is going to be reabsorbed. The 24 liter of water is being filtered into the tissue, but coming back, it is only 21 liter that is being reabsorbed, and the remaining is going into the lymphatic system for more filtration and drainage. So that's what happens. It is not all fluid that gets reabsorbed into the venous or end of the capillary wall. So imagine this scenario, guys. Just have an imagination. Imagine a sponge inside the capillary sucking water in. Like that protein, they act like a sponge So what does sponge do? They reabsorb water. So that is what this capillary osmotic pressure is. So clinical relevance. They said if hydrostatic pressure increases, like in heart failure, what do you think will happen in this case if the hydrostatic pressure increases? For instance, a patient who has a heart failure, what do you think will happen? Remember we mentioned that the hydrostatic pressure is called the push out. So what's going to happen, that more fluid is going to be pushed out into the tissue. And when that happens, what do you think will be the result? Yeah, edema. The patient is going to have edema all over. Yeah. And then another one, if osmotic pressure drops, like in low albumin from the liver, no, or malnutrition, what do you think will happen if the osmotic pressure drops? Remember we mentioned that the osmotic pressure is the pulling, and if the osmotic pressure drops, there will be the fluid that is going to be reabsorbed there won't be enough pull. So there won't be reabsorption of this fluid, and what's the end result? Still the same, edema. So good news, guys, we are done with the blood vessel. Yeah, if you haven't been following this series, go check the cardiovascular series, the blood vessel. We talked about the artery, the arterioles. We talked about the capillary and the sinusoid. We talked about a lot. We talked about mostly the blood vessels, and soon we'll be moving over to the heart. We'll be talking about the heart, because before we resumed, we said that the cardiovascular system is mainly made up of the heart and the blood vessel, and we just finished the blood vessel, so we'll be moving over to the heart. But before that, let's make a spot check. Let's know if all we've been talking about, all this while, if it's entering in storing up there. So it said here, list the 3 layers of tissue found in the walls of the arteries and vein. Can you give it a try? Can you? And here, the 3 layers, we know the 3 layers of these blood vessels. They are the outer, the middle, and the innermost layer. And that's the outer is the tunica adventitia, which is also known as the tunica externa. The middle, which is called the tunica media, and then the innermost, which is called the tunica intima. And we all know that the tunica externa is the outer part, and it's mostly made up of collagens and connective tissue components, which it serves as a strength, like it protects the blood vessel. So then the middle is made up of variable amounts of smooth muscle and elastic tissues, which we said that it helps the blood vessel to withstand the pressure that is coming from the blood, from the blood coming from the heart. That is the arteries, the blood vessels, the arteries that are closer to the heart, such as the aorta, they have they're mostly made up of these layers. Then the tunica intima, which is also known as the endothelium, which is just one cell thick. And then they said compare and contrast the structure and functions of the capillary and sinusoid. You know that the capillaries, what they do is that they make the exchange of stuffs possible in the between the tissue and the blood. And the sinusoid is just the capillary that is found in most places, such as the liver or the bone marrow. So they are more leakier, and they are low pressured, and the blood moves slowly for time for like such as in the liver.